Alright, welcome to this video. In this video, we will talk about the pharmacology of peptic ulcer, that is to say, the drugs we use for the management of peptic ulcer. I believe you know very well peptic ulcer is very common. It simply means an erosion in the epithelial lining of the gut, particularly the stomach and the duodenum, because peptic ulcer involves both the stomach and the duodenum. So peptic ulcer has the gastric component and the duodenal what component. But for today, what we want to focus on is the pharmacology behind it. What are the drugs we use for the management of what? Peptic ulcer. Now, the first class of drug we use are the drugs that decrease acid secretion. You know, the more acid you secrete, the more it is going to irritate that ulcer. So the first set of drugs we are going to discuss today will be the drug that, in a way, decrease the secretion of what? Of acid. Okay, so we just put a diagram here. We'll put a diagram here. Imagine this is the stomach. Okay, so just imagine this is the stomach, and lining the stomach are certain cells that we call parietal cells. Okay, parietal cells. These parietal cells, they are responsible for secreting proton. Okay, they secrete hydrogen. They are the ones that are responsible for producing the acid. Okay, so I'm going to pick out one parietal cell and show you how it actually secretes acid. Are you getting it now? So imagine now that this is a parietal cell. Now, take note that this is the luminal part of the parietal cell. This is the basolateral part. Okay, so here is the luminal part. Imagine here is the lumen. So here is the luminal part of the cell, and here is the what? Basolateral part. Why am I stressing this? Because on the luminal part of the cell, we have a pump that is called the proton or hydrogen potassium ATPase pump. Hydrogen potassium ATPase pump, for short, it is called proton pump. Okay, so I will just label this one as what? As the pump that pumps what? Proton into the what? Into the lumen. So I will call it for short proton what? Proton pump. Okay, then on the basolateral part, there are about 3 receptors that when they get stimulated, they have the ability to pass the signal down to this proton pump to in turn stimulate the proton pump. What am I trying to tell you? There are certain receptors on the basolateral part of this parietal cell that when they get stimulated, they will send the signal down to this proton pump to cause secretion of proton or hydrogen, which simply means secretion of acid. Are you getting it now? Okay, so now we have the receptor H2 receptor, we have CCK receptor, and we have receptor for M3, also called receptor for acetylcholine. Okay, so take note of that. H2 receptor, CCK receptor, M3 receptor. Now H2 receptor is stimulated by what? Histamine. CCK receptor is stimulated by what? Gastrin. Right? Then M3 is stimulated by what? Acetylcholine. Are you getting it now? So in the physiology of acid secretion, take note that this proton pump is what actually secretes the acid, but it gets signals from stimulation of these receptors. Are you getting it now? So when histamine stimulates histamine receptor, that is H2 receptor, it will send signal to this proton pump. When gastrin stimulates the CCK receptor, it will send signal in turn to the what? To the proton pump. Then when acetylcholine stimulates the M3 receptor, again signal will be sent to the proton pump. Are you getting it now? So it means that the drugs we will use to manage peptic ulcer disease should be able to inhibit these 4 mechanisms. But picture a drug that now inhibits this one. If a drug inhibits this one, I believe you want to say that drug will be very what? Very effective. Is that not so? Because this is the converging point. This is the what? The converging what? Point. So the first class of drug we will talk about will be what? Proton pump inhibitors, which we call PPIs. Proton pump inhibitors. This will be the first class of drug we will discuss. Then the second class of drug we will discuss will be the drug that inhibit what? H2 blockers. So we call them what? H2 blockers. Okay. H2 blockers. Then we also have drug that will inhibit M3. So we just let me put it on this side. So here is M3 blockers. Okay. Then for CCK, there is no drug yet that actually acts directly on that CCK receptor. Are you getting it now? So for now, under the drugs that inhibit or reduce the secretion of acid, the major one I want to take note of is the proton pump inhibitor and this H2 blockers. You can also take note of M3 blockers, but majorly these two, the proton pump inhibitor and H2 blockers. Is that clear? So what have I said so far? I've told you that in order to secrete acid, we need this proton pump, right, on the luminal side, which secrete what? Proton into the lumen. Now, the signals for the secretion of that proton is coming from histamine, H2 receptor, CCK, and M3. Okay, so if we can inhibit this pump, we are going to reduce the acid secretion, and by so doing, we are going to alleviate the ulcer pain. Okay, then if we can also inhibit these guys here, we can also what? Alleviate the ulcer pain, we can reduce the acid secretion. So these drugs that are working here, all these drugs we're talking about now, they are all drugs that work by reducing acid secretion. Is that clear? All right. So now we'll move further and talk about what? Proton pump inhibitors. We'll move further and talk about proton pump inhibitor in the next video.